Hey, and welcome back to episode 40 of Hiss and Tell. I am your host, Christina Wilson, and today I'm joined once again by the wonderful Dr. Gina Rendon, Medical Director of Williamsburg Vets. In this episode, we're diving into FLUTD, which is feline lower urinary tract disease, and idiopathic feline cystitis, and why these conditions matter so much on a cat behavior podcast. House soiling is one of the most common reasons guardians reach out for behavior help, but all too often, what looks like a behavior problem is actually driven by pain, inflammation, or stress-related medical disease. Let's go. Welcome to another episode of Hiss and Tell. I am your host, Christina Wilson, and with me today, as often is the amazing Dr. Gina Rendon, Medical Director of Williamsburg Vets. Welcome, Gina.
Thank
Yay.
you. So thanks for inviting me. Yay.
You're back. And
I'm
today
back.
you're back. Today we're going to be talking about FLUTD and idiopathic feline cystitis. And we are talking about that on a cat behavior podcast because I will say, at least I get a lot of house soiling cases. And a lot of the time when it's house soiling cases that have to do with what people used to call inappropriate urination, I always want to know, has the cat been checked for these two issues? Could it be a physical driver? And often these issues can be the physical driver of what people consider a behavioral problem. So here we are to discuss what the heck these things are and how they pertain to your cat's behavior. So Gina, for listeners who might be new to this topic, can you explain what FLUTD is and how idiopathic feline cystitis kind of fits under that umbrella?
Absolutely. So FLUTD stands for feline lower urinary tract disease. So that's an acronym, and we just pronounce it as FLUTD. And there's actually been several names for this basically umbrella term that describes a bunch of different types of urinary issues. So this is not actually a diagnosis. It's a description of various things that can affect the urinary tract. So it used to be called FUS, so it was feline urologic syndrome, and then they called it FLUTD. FIC can be either feline interstitial cystitis or idiopathic cystitis. And then there was one person who came up with the term Pandora syndrome, which is the stress type of medical changes that can happen with cats. So stress-induced medical issues, which can include urinary issues, respiratory issues, dermatologic issues. And so that it's basically stress opens up the big box of bad things for kitty cats. But FLUTD seems to be the term that's most commonly used, even though people also use FUS. So if you hear people talk about FUS, that's another kind of interchangeable term. But so basically, this is a description of a category of diseases that can affect the way a cat urinates. And so things like urinary tract infections falls under this umbrella, bladder stones, what we call idiopathic cystitis, which basically is a diagnosis of exclusion. You have to rule out some of these other things. And then you can also have things like congenital issues. So not that long ago, we actually saw a kitty cat that had what we thought the cat was a hermaphrodite. Yeah, which was really interesting. And it was a really young cat who was having urinary issues. And we wanted to try to see if we could pass a catheter and realize that the anatomy was completely anomalous. It was not what we expected. And there were other issues going on with the kitty. So there were renal issues as well. So we did end up sending that animal for referral. And then I don't know what ended up happening. We lost that cat to follow-up just because it was so young and there was a lot going on with it.
Right.
I'm not sure that the owners actually opted to continue treating. But so there can be anatomical issues. And then for older cats, sometimes there can actually be cancer-causing issues that will make a cat not able to pee or to strain. So FLUTD, like I said, is an umbrella term. And then FIC is feline interstitial cystitis, and that, or feline idiopathic cystitis. And that specifically, idiopathic cystitis tends to be associated more with stress and is actually the most common cause of urinary issues in cats, more than UTIs and more than some of these other issues.
Yeah, I can say from personal experience, we have one of those cats in our house, as you well know. Good old
Yes.
kitty
Well,
man.
So, as you know, I just got back from a conference. And so I did sit in on a
Mhm.
conference on FLUTD because I knew I was going to do this podcast. And so I just wanted to see
Yes.
if there was any new information. Actually, one of the interesting things that I learned was that, because I did not know this, that cats that tend to be more predisposed to this are the really sensitive cats, and and
Mhm.
they may have smaller adrenal glands and are unable to
Oh.
manage stress the way normal cats do. So there do seem to be cats that are a little bit more predisposed to developing these types of reactions to stress.
Mhm.
And they tend to be the cats that are just really, really sensitive. They're a little bit more
Yeah.
fearful. They're much more reactive. They're always on guard. There may be a decrease in their production of cortisol, which is really interesting, and probably have higher
Mhm.
levels of like norepinephrine and epinephrine that are causing physical changes. But that was something that I had never heard before, and I thought that was very interesting. So,
That's
um,
super interesting. I would love to read if there's any papers or anything you got from that. I would love to read
I'm
anything that was
sure this
associated with
person
that.
had her references, which they're probably in the proceedings, so we could probably find them for
Yeah.
you.
Yeah, that would be cool, but it's just let's just talk about my problems. It's all about me. But, with Kitten Man, he has always fit that bill, right? And he's also super, super smart, and I've noticed also with my
Mhm.
clients who have cats that present like this, they have a history of, like, always being very anxious, like, kind of just having
Yeah,
being more reactionary, but also being, especially if it's a multi-cat household, being the most intelligent in the house,
interesting.
and
Uh-huh,
I think
yeah.
that leads to, like, they need so much more intellectual stimulation, they need so much
Yeah,
more
yeah,
engagement, but they're
yeah.
still just kind of that intelligence makes it so that they're in these,
They
like,
worry.
stress
Yeah, they
loops
just
and
worry
worry and
all the time.
anxiety.
Yeah,
Yeah,
yeah.
so there's been a lot of that, but I will say that the Effexor has helped so much. It has
Oh,
been
good, excellent. I'm happy
such
to hear
he's
that.
really doing so much better,
That's
so
fabulous. Excellent. So that's
thank
good to
God.
hear.
Yeah.
Yes.
Anyway, okay, back to the questions. Why do you think that urinary conditions in cats are, like, so often mistaken for purely behavioral problems? Because I can at least say from my end, so much of what I see, people come to me like, "Oh, my cat's peeing all over the house," and they have not gone to the vet.
Right. Yeah. I mean, I think it can go in both ways, which I think is kind of interesting because, for cats, the stress behavioral part can result in medical issues, which I
Yes.
think is I mean, it's I think true for most biological creatures. We all have
Mhm.
our medical issues that can arise from stress. Cats, there are certain cats that just seem to be much more sensitive, but I think people just don't really think about it. And I think one of the things that is frustrating from my point of view are people who think that it is because a cat is trying to express displeasure with them specifically. They think a cat is
Yes.
being vindictive because
Or
of whatever
spiteful.
or spiteful, and so now they're
Yeah.
peeing outside the box and they're peeing on the carpet, and what they don't realize is that there are so many other factors that are involved, and that it really can be a medical issue, that it can be something where they have enough changes in their bladder that it's really uncomfortable. And so when
Mhm.
they pee, it hurts, and they associate that maybe with the litter box. So I think people just don't really realize that really deep connection between behavior and medical issues, especially
Yeah.
for cats. Yeah.
Yeah, I agree, and it is just like you said, it's often like an overlapping Venn
Hmm.
diagram, that it's not purely one
Yeah.
or the
Yeah.
other.
Yeah.
Yeah.
But it's
What
rarely because a cat is vindictive. So
ab
that
absolutely, yeah.
it's
Yes.
not that the cat is trying to tell you off, it's
Yeah. No.
rarely that. So, yeah.
I agree. Yeah. At what point should house soiling always be considered a medical emergency rather than a training or behavior issue? And I can tackle this from my end as well, but let's hear your answer.
Well, so for me, a medical emergency means that something really serious can happen. And
Yes.
and usually for these types of cases, and we can certainly talk about this a little bit more with if it is FIC, if it's,
Uh-huh.
an interstitial cystitis type of a thing, cats can not be able to pee. And this is typically male cats where there's enough
Mhm.
inflammation that their urethra will basically just close down. And so it's a medical emergency if your cat is trying to pee outside the box and they're not actually able to pee. And so, and anytime I think, anytime you see a cat that's going in and out of the box or trying to pee around, any places trying to pee on the bed and you're not seeing anything come out. I mean, as far as I'm concerned, anytime they're straining to pee, they need to be seen immediately, whether they're male cats or female cats, because either can be potentially obstructed. And that's a medical emergency. They can die from that.
Yep, absolutely agree. That's what I was gonna say, obviously. And you know that in our house we have cameras in front of all the litter boxes, so
Yes,
that
yes.
makes it a little easier to be able to be like somebody's acting funny, like especially with Kitten Man, who is our stressy guy who has blocked before. Is I'll always notice like, oh, he's doesn't want to eat. Even if I give him a churu, he doesn't want to eat. And then I'll go and look at the footage, and then I can see like, oh, I've seen him go in and out of the litter box a lot.
Hmm.
That seems strange. We better get
Hmm.
him to the vet. And then
Hmm.
every time that has happened, he's blocked and then has to,
Uh,
stay in the
ugh,
hospital. But
right. Yeah.
you can start to notice those signs, or is your cat super lethargic, and
Hmm.
other signs like that.
Yeah. Yeah.
So, what are the most common signs of these issues that guardians might overlook or misinterpret?
I think the main thing is not using the litter box, even though there are
Yeah,
multiple reasons for cats not using a litter box. And I think we've talked about this before in other episodes, what an ideal box is and locations and
right.
number per cats in a household. I think we've talked about all of that. But things like, I think one of the really overlooked sign is over grooming. And so
Mm,
kitty cats that have inflammation in their bladder they will groom their belly to the point where they're bald. And that can be associated with other things as well. So sometimes
right.
that can be associated with things like pancreatitis, but it's also something that we see with cats that do have idiopathic cystitis. So that might be something that people don't realize. Peeing outside the box. When it gets to the point where a cat is vocalizing while they're peeing, I think most
Mhm.
people will kind of get the idea that that's not good, and
Yeah,
especially because at that point, it's that really terrible, distressing
the
type of,
yowling.
yeah, which is so
Yeah.
awful to hear. But the more subtle things can be just not wanting to use the box, going more frequently, so going in and out of the box, and then over grooming. Anytime you see blood in the urine, which is not always
Mm,
visible, there's the pretty litter now can sometimes detect that early. So anytime there's blood in the urine, that would also be something that's a concern. And
yeah.
so sometimes actually, now that I say that, people will report that their cat is peeing in the bathtub, and I don't know why cats love to pee in the bathtub, but a lot of them do. And that's sometimes one of the first times that you can actually recognize that there's blood in the urine
Mm,
because it'll show up on the white ceramic or
yeah.
whatever tubs are made out of. Yeah, so blood is definitely a warning sign.
I've had both bathtub and sink peers, and
Yeah.
I think it's because it's shaped like a giant litter box,
Uh-huh.
the
Yeah,
tub.
yeah, sure. Uh-huh.
So and I also think a lot of times they watch us on the toilet. At least the cats that we had that like to pee in the tub would watch
Uh-huh.
us go to the
Uh-huh.
bathroom right
Uh-huh.
next to the tub, and I think got some idea in their head about the drain and the toilet and the tub,
Uh-huh.
because
Uh-huh.
they would try to go into the drain of
Uh,
the tub,
sure.
which at
Yeah.
least made it
Yeah.
easier. But I think
Absolutely.
generally, if you see that in your house, what that behavior tells you, not to go on a total tangent, but we're still talking about the litter box, is that
Mhm.
your litter box isn't big enough
Right.
because
Or is
they
somehow
want a
else inappropriate. Yeah. Yeah.
yes, yeah, that there's some kind of bathroom issue, but if they seem otherwise healthy, probably get a much bigger box
Yeah. Yeah.
if that's
I
what
mean, I
they
think
want.
this is a good time to talk about those other things in case
Yeah,
people haven't seen our others. So, if you have your litter box next to the washing machine, probably not a good idea.
yeah,
Or a high traffic area, if it's too small. Some cats don't like them covered. Some cats don't
mhm,
like crystals. Most cats really like the sandier types of litters and the scoopable litters, and they like clean boxes. So, those are all factors that a cat will use to decide whether they're going to use the box or
yeah,
not.
yeah. Yeah, there's definitely a lot of rules governing it, and it's interesting
Yes.
to watch in our house of 15 who uses what restrooms and what strong preferences they have, and
Mhm.
most of them will use whatever box is closer, but we do have a few who have strong preferences that, like, they'll only use the litter robots, or they'll only use,
Uh-huh.
you know, the traditional box, and we have a couple who will only use a enormous box that we put in a bathtub, so
Uh-huh.
that
Oh,
there's, like, a
interesting.
super
Yeah.
extra
Yeah.
jumbo giant box,
Uh-huh.
and then they
Right,
go on.
right. The box in the
So,
box. Yeah,
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 the box in the box, it's just like, I have so much
yeah.
data, I could write a whole case study on it, but who wants to read that? And I certainly don't wanna write it.
I'm sure there are
Anyway,
plenty of people who would wanna read that.
well, great. Anyway, moving on. Are there differences in how, these issues can present in male versus female cats?
Yes, definitely. So they both can have the same type of symptoms that the human caretaker will witness. So they can
Right,
both go in and out of the box and go outside of the box and do the over grooming. But one of the big differences that based on their anatomy, male cats are much more likely to have the urinary obstruction as
right.
opposed to female cats. And that's because the urethra in the male is longer and thinner. This is like in the humans as well.
Mhm.
And so any kind of inflammation in the urethra could potentially close down the urethra where they cannot pee. And so that can be, in the absence of stones, which can also cause obstructions, in the absence of other things, it really is just inflammation. I have seen female cats block very, very
Mm,
rarely, but so that can also happen. More frequently, they can block with stones, but I have seen it where it has been idiopathic. There's no
hmm,
UTI, there's no stones. It's just a lot of inflammation. And I'm assuming that there's some anatomical variation as well with female
right.
cats, that some of them are going to be at higher risk. But the main thing is that if you have a male cat and you see this behavior, you need to go to your vet. You need to make sure that they're able to pass urine because it can be a problem. With female cats, I feel like sometimes you have a little bit more time, but
Right.
still, if they're uncomfortable, you really want to address their discomfort, anyway. So,
Absolutely.
but
Yeah.
that's the biggest difference is that males are much higher risk for blocking.
Okay. Can you talk a little bit about how stress actually affects the bladder in cats?
So we talked a little bit about this in terms of the hormones. So
Mhm.
increase in these adrenaline-like hormones, and that actually has an impact on the lining of the bladder. So the bladder is lined with mucus, basically, that
Mhm.
protects it from the acidity of the urine or the pH of the urine, whatever that might be. And so if there's all of these hormones, that can actually break down that barrier, and so the urine can become irritating to the lining of the bladder. They don't have that
Mhm.
protection anymore. And so it can actually cause ulcers within the bladder, and a lot of pain. And so it's a physical disruption basically of that protective layer. Or, in some cases, they can actually have stones that are developing. So either struvite or calcium oxalate stones, which is different from what we've been talking about. So it's not that's not the behavior related one, but
Right.
there's definitely an overlap where that can potentially exacerbate an interstitial cystitis or an idiopathic cystitis. I guess at that point it is just interstitial.
Yeah. Does it also cause urethral spasms? Because when
Yes,
our cat
absolutely.
yeah.
Yeah, yeah,
Okay.
for sure. Yes, yeah. And that can
Okay.
also happen. Yeah. So it
Yeah.
affects muscle too. Yeah.
Right. That's just because and I've read papers discussing whether or not this medication is actually helpful in these
Uh,
cases.
Prazosin.
Yeah,
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 yeah.
yeah.
But every time that Kitten Man has blocked, they've scripted him Prazosin
Hmm.
for the following few days after he goes home, and then, for their urethral spasms. I don't know why that's so hard to say. But yeah, I've read follow-up papers in newer research saying like, "Well, we don't know if this
It
actually
doesn't
does
work.
anything." Yeah,
Yeah,
exactly.
yeah, yeah, it's interesting. I feel like there's always these shifts in thinking, and so, we were using Prazosin for a very long time and then
Mhm.
starting to get these reports that maybe it wasn't really doing anything and it wasn't indicated, and then when we didn't use it, we would find that sometimes for some cats, it would take longer for them to recover, so then you
Mhm.
add it back on, and then it seems like it helps. So, I feel like personally, I don't feel like it really hurts. I haven't
Right.
seen any serious side effects from in fact, I haven't had anybody report any side effects from Prazosin. And so, I think that's definitely something you wanna discuss with your vet. I'm not gonna make
Mhm.
specific recommendations about what your vet should do,
Sure.
but it is something that's available, and I think there is, especially if you have a cat that's really not recovering, then adding that on certainly would be an option.
Okay. Do you see in your practice, do you hear like about what kind of stressors that are triggering these flare ups? I'm guessing you do. I can
It's
also
well,
answer that
you
from my
know,
practice, but
yeah, it really is the very first question that I ask whenever I have a
hmm
cat that is having these types of symptoms. And so it's always this question of, is there construction? Did you go out of town? Is somebody visiting? Is there, you go through like the entire list. What
hmm
has changed?
yeah. Did you
And
add a new cat?
did you add a new cat? Did you move the position of the litter box? And so this is,
Yeah.
I think, one of the interesting things with these really sensitive cats is that you don't always know, and it can be something that you feel like is really minor, but
hmm
to that cat is something that has just made their lives, unpredictable, and
Right.
they're so I think, it definitely can be the big things, and that's something to be aware of, but sometimes it's small things that we don't really think of as being a stressor, and for that cat, that really sensitive cat, it can be something that sets them off.
Yeah.
But so
Do
the
you?
most common things we see, I feel like, are vacations. People
Oh,
going on
yeah.
vacation and then they come back from vacation and it happens after they get back. And I'm not really sure
hmm
why it's timed that way, but I feel like my just anecdotal experience is that that is the most common thing. It's after the holidays, after travel season. That's when we see a lot of cats that are symptomatic.
That's totally fair. And this is again anecdotal, but Kitten Man's been so good. And we were supposed to go again last week to Virginia. And
Uh
because of
huh.
so we couldn't go because our flights got canceled like
Oh
800 million
no.
times. So we still
Uh huh.
haven't gone.
No.
It was so insane. Anyway, that was the whole thing. So we were at the airport all day, and their cat sitter, our friend Emily, who Kitten Man loves, like the second
Uh
she
huh.
came in the house, he ran up to her and was just like, "Yay!" He loves her. But because we left, he hates that. When he sees us even
Yeah.
packing
Yeah.
anything,
Yeah.
he loves
Packing.
her, but it's still not right. He hates that. So we left, and while we were gone, he peed in the sink in the guest room.
Oh.
So very neatly, but it
Mhm.
still was enough to cause stress.
Yep, yep.
Even though he loves her so much, there's someone there 24/7 to attend to everyone's needs, to
Uh-huh,
feed like,
sure,
nothing
yeah,
has changed except for us leaving that stressed him enough to not push him into these into, like, any kind of inflammation, hopefully, but
uh-huh.
to
Yeah,
give him
yeah,
stress enough to house soil.
right, right.
So, that was a behavioral issue, but I do think it's
Uh-huh,
interesting that that speaks to how stressy, like,
yeah. I was thinking
people
about
leaving
this.
it.
Yeah, yeah, and I was thinking about this, like, when there are predictable stressors, like, if something is gonna you're gonna have people who come to
Yeah.
visit, and it just whatever changes their routine.
Mhm.
With dogs, the predictable stressors like fireworks or
Right.
thunderstorms will set them off. I feel like we're much more proactive about starting them
Yeah.
on a, anxiolytic that will help them
Mhm.
to get through things, and I don't think we do that with cats, and I don't
We
really
don't,
know
and
how effective that is. I would be curious, if there were cats that were predictably disturbed by these things, if it would make a difference to get them started on something like a
I was
short-term
gonna
type of
ask you
anxiolytic.
about that. For
Yeah,
the next
yeah.
time that we travel, I wanted to try him on the night before, the day of,
Mhm,
and then because he's
mhm.
very easily pilled, Emily can give him like, no problem. Just give
Uh-huh.
him, like, a 2 to 3 day protocol of trazodone or whatever you
Yeah.
think would be good
Yeah.
and
Well, so
see
that's
if
what I was
that
trying to think, yeah, because I feel
yeah,
like with trazodone, the only downside to trazodone is that it just makes them,
out of it.
glassy
Yeah,
out
I
of it.
know.
Like, you see them and they just
Yeah.
look stoned, and
Yeah.
I don't love that, and so I
Yeah.
I was trying to think, like, are there other things? Gabapentin also makes them sleepy,
Yeah.
and I was trying to think if there was some other thing that you didn't have to wait a month for it to get on board
I
to
know.
make a difference for things. I'm not 100% sure, but it's something that I've been thinking about, and maybe you and I will come up with something that we can try with Kitten Man.
Let's think about it, and then I'm more than
Yeah.
happy to try it because I really do feel badly for him. Like, everyone else is fine, they don't care. They're like, "Emily's here, yay!" And then he is just like, "I love
Oh
Emily,
my
but
god.
my
No,
routine, I've gotta piss in the sink,"
yes, yes.
And then we came home, and he was like,
Mhm.
Oops, you're home. I don't know. He was
Oh,
so confused.
everything is fine. Right,
Yeah,
right.
he was like, "Oh, you were just gone for 8 hours sitting at the airport, like, whoops." So, I would be really interested to try that and see how it
Yeah.
goes, and then I think that would also make for a very interesting, longer study at some point to see if
Yeah.
that is actually effective. Just like my colleague did that at ACC with dogs, putting them on 3
Mhm.
days of trazodone when they come in as an intake to the shelter, and it really helped them
Made a difference.
adjust. It made a
Uh-huh. Yeah. Yeah,
huge
yeah.
difference, and so now that's their protocol.
Yeah, yeah. And I mean, I think that's one of the protocols for a lot of vet hospitals these days is giving, I mean, it's what we started doing. You
Yeah,
give the sedatives the day before having to
right.
come in, you know, for just for routine visits if it's a really stressy
Mhm.
animal. We do it a lot for cats now, but also for
Yeah,
surgical if they're going to be there for the day, making sure that they have something ahead of time just so that they're not freaking out. And I do think it
right.
makes a big difference. So, yeah,
Yeah.
a
Alright.
good
Well, I
direction to
think
be moving in.
I agree, I agree. So, have you seen multi-cat households complicate urinary issues even when there doesn't seem to be conflict?
Yeah, I mean, I think that uh, I mean, the statistics are that cats in multi-cat households are definitely at higher risk.
Right.
So we see that a lot more. And I do think that you have to be a very attentive cat owner to sometimes be able to really detect when that stress is happening.
Right.
Obviously, I know that you are very attentive and you do have all of your cameras, but not everybody is. And so, even if there's not overt aggression or overt, issues going on, it can be very subtle. And
Mhm.
one of the lectures that I went to was showing some of the, I can't remember, it wasn't on FLUTD, it was a different one, but there was a video of these cats in an 11 cat household and one cat was walking by the other, and if you weren't watching you wouldn't think anything was happening, but
Mhm.
if you're paying attention you can see it's like the shift of the ears, like just
Yeah.
the tension in the body, like just enough subtle changes that one of the other cats kind of veered out of the way,
The wide
and
circle. Yeah.
the wide circle, and if you weren't paying attention, you would just think, "Oh, he's just moving away." But there was obviously tension, there was obviously something going on, some communication that they were doing
Yeah.
that's really subtle. So I do think that these things happen in multi-cat households a lot more than people think, and it, for especially for those really sensitive cats, it can be
Mhm.
really impactful. So, yeah.
I agree, and that's one reason why I really believe in setting up motion sensor cameras for everybody. Just because not to turn your house into a police state, put them at cat level. People then you'll only be, watching your feet. I do think that especially because 'cause we're all busy, you miss out on a lot of these subtle
Yeah.
behaviors, and it's so helpful to be able to go back and put things frame by frame or in slow
Yeah.
motion and see, like, that cat was giving this cat the side eye, or like you said, the ears move or the
Mhm.
wide circle. Like, what's
Mhm.
happening here? These guys are coming face to face, and that's really aggressive, or, like, where do I
Yeah.
need to put some height? Is there a narrow hallway like you were maybe describing? It sounded to me like that's probably a narrow hallway issue, and, like, maybe I need to put a little height there, like put an Amazon
Uh-huh.
box or something so that they're not coming face to face. There's
Right,
so many
right.
little changes that we can do to improve the situation so that it kind of de-stresses things for
Mhm.
cats when they're
Mhm.
living in
Yeah.
multi-cat households. And definitely we have too many cats, like 15 cats is too many cats, but unfortunately in this small town, we just can't find anyone to adopt all the cats that just show up at our house. And so it's a lot of work to constantly, like, watch out for these things and maintain the relationships and try to make sure that everybody's happy. But and now I lost my train of thought. I was going somewhere and then my brain just went, "No,
Well,
you're not."
so yeah, no, the train of thought that a lot of cats can be it's harder to monitor those individuals to see who's
Yeah.
gonna be affected, so yeah. And I think, the cameras, I think are it was another thing that I got from this conference. I really feel like, at a minimum, having cameras around litter boxes is
Yes.
really important. Yeah, and so that's something that I'll definitely start encouraging cat owners to
Yeah.
do, that,
I agree.
they should, yeah, monitor
But
that.
I will say having all of our cameras all over the house did help us figure out who knocked over our Christmas tree last week. So
Who was it? Who was the culprit?
it was a combo of our two of our biggest guys, Gene, who's 16 and a half pounds, and
Uh-huh.
Tubbs, who's 12. They're, like, not our
Uh-huh.
fattest guys, but they're our
Uh-huh.
physically biggest guys. and
So
they
the
were
2 of them
running.
together.
Yeah,
Uh-huh.
they converged. They were running through the living room, and they converged at the tree, and they didn't jump
Nice.
into the tree. I'll send you this
Uh-huh.
video because it's really funny.
Oh
They
my god, so
converged,
hilarious.
and then
Uh-huh.
they must have hit the pedal on the tree stand, that, like, locks
Uh-huh.
it,
Mhm.
because you hear them hit the tree, and then you hear this clunk, and then the tree takes a second or 2 because I think it unlocked the pedal, and then the tree goes. And by then,
Timber.
yeah,
Uh-huh.
by then they were in the kitchen. Like, I could see them
Oh,
by the time the
wow.
tree fell, they were already in the kitchen.
Thank
So,
God, though, right?
yeah,
Yeah.
thankfully, thankfully.
Oh my
I
god, like a cartoon.
It was so like a cartoon, and I had to go back. I'm always like, "I'm gonna go to videotape you guys because I can," and we can almost always figure out who did whatever the thing was.
That's
So,
hilarious.
not
I
like
love
they
it.
didn't get any trouble or they didn't
Right,
do it on
of
purpose,
course.
but
Just
it was
yeah,
just funny to
yeah.
be like, "What idiots did this?"
What? How did this happen? Yes,
Yeah,
yes.
exactly. So,
Yeah,
when there's
yeah.
15, you do have to kinda wonder, like, which ding dong was responsible for this accident?
Right,
So,
right.
anyhow,
Yeah.
so how is FIC diagnosed, especially because it's a diagnosis of exclusion, like you said?
Yes. So obviously you want to have your physical exam, you want to see your
Mhm,
veterinarian, and they will start by, doing their full physical exam. If there's a question about whether the cat is obstructed, the first thing they do is feel the bladder.
mhm.
And if it's an orange size hard bladder, then that's when it's an emergency and you need to, take steps to unblock that cat, however that might be. So if the cat is not blocked, then you really do want to do things like collect a urinalysis. And so either having the vet collect a urine, or if you want to collect a urine at home, we can talk about how that's an option. But do a urinalysis, do a culture. The urinalysis is basically looking for inflammation, looking for crystals in the urine, protein, cells, things like that, how concentrated the urine is. And then the culture is specifically looking at bacteria. And sometimes you'll see bacteria in a urine that's not what we call pathologic. It's not
Mhm.
bad bacteria. And so you don't always treat bacteria in all cases. And so even though I did say that it's really uncommon for urinary symptoms to be UTIs, it is really important to check for them for bacterial infections.
Right.
And so and especially because you can't just assume just because it's a boy it's not going to be that.
Mhm.
I've been surprised and have found male cats that have had UTIs, and so you treat it, and then the behavior goes away. In some
Uh-oh.
cases, kind of depending on what's going on, if it's an older cat that's showing symptoms, then doing blood
Mhm.
work, because sometimes, there can be other issues that are involved. So, cats that have diabetes, their immune system is much more compromised, so that can be a UTI
Mhm.
more commonly than regular cases. And then in some cases, doing x-rays to rule out things like bladder stones that can be very
Mhm.
irritating to the bladder, doing an ultrasound. So there are stones that are radio, which means they don't
Mm.
show up on radiographs. I've seen that once. They were called xanthine stones in a young cat. So we took our x-rays, the cat was blocking. We took x-rays and we didn't see any stones, and the cat continued to have urinary tract issues despite everything. We did an ultrasound, and it had these radiolucent stones that had to be surgically removed. So sometimes ultrasound, and then in some cases, like if you had a cat that the anatomy was questionable, then doing something like contrast urethograms. Is that how you say it? Where
Sounds
you're
right.
actually, yeah, sounds right, where you're actually you can see the flow of the contrast through the urethra into the bladder and make sure that there's no obstructions that way. So there are a variety of different diagnostic steps, but I do encourage the urinalysis and the culture
Right.
just to rule out the easier things to treat.
This is a really stupid question. So when you say that a cat is blocked, especially
Uh
like
huh.
a male cat, are they blocked always with a stone or can they just be
No.
blocked with inflammation?
They
It
can
can
be
just be
blocked
so
with
swollen.
inflammation. It can
Got it.
just be
Okay.
so swollen, yeah, or there can be so much inflammation in their bladder that they can get what's called a plug, which is like a
Mm.
plug of mucus. Sometimes there are crystals in there, but it can just be cells, and so
Huh.
they can have these plugs in their urethra. Yeah, that will cause the obstruction, but sometimes it really is just so much inflammation that that little tube basically just closes up. It just
Okay.
closes up. Yeah.
Okay. All right. Is there anything that you wish guardians understood more about that whole diagnostic process for urinary issues that you just went over?
Yes, actually, because we do see a lot of people that will come in and the cats are peeing outside the box and they just want the antibiotics. And that is so common. Just give me
Yeah.
the antibiotics. I don't want to do any testing. I don't want to, I don't want the data. I just want to start antibiotics because that always helps. And we hear that a lot. And these cases do tend to be self limiting, which means that
Mhm.
if you wait long enough, they can improve on their own. And so people will start an antibiotic, and even just waiting from time, eventually those symptoms will clear. And the
Mhm.
antibiotic has done absolutely nothing. And so, especially now when there have been so many antibiotic resistant infections developing,
Right.
on the human side, it's really a dire situation that we are in terms of our antibiotic use. And so I really discourage antibiotic prescriptions that are not based on, on actual
Data.
proven
Yeah.
infections. Yeah.
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 Is there a similar crisis in the pet world as there is in the human world in terms of
Yes.
antibiotic
Yeah.
resistance?
Yeah.
Yeah.
Yes, definitely.
Okay.
It's across, it's across the
Yep.
globe. And the United States has higher rates of, I just went to another talk,
Yeah.
higher rates of resistances because we use so many antibiotics.
Yeah.
So it's very high. Yeah, it's really scary actually.
I don't doubt it. So, what does evidence-based treatment for FIC or fluted look like today?
So, evidence based treatment, one of the things that seems to help more than anything else is increased hydration. So, getting your
Mhm.
cat to drink more and switching if your cat is on dry food. And this, go back to our discussion about nutrition. If your
Mhm.
cat's on a dry food, stopping the dry food and trying to switch to an all wet diet. Because I have found, and again, this is anecdotal, but I think there's also evidence research that backs this. I've had cats that have had urinary issues, had issues with FIC. You start them on a wet food diet and they do great. You add water to their food, you hydrate them, and then a couple of years later, the clients will be like, it's just so easy. I'll give them some dry food, and then they block again. And I've seen that enough
Yeah.
times that I really, really, really believe that the diet is such an important element. And so, uh, wet food diets, and I'm not gonna even, there are urinary diets that are on the market, but,
Mhm.
unless there are stones, and they actually even have urinary diets for, like, multi-cat household and,
Right.
all of this stuff, but really it is wet food, increasing their hydration, and so I recommend low sodium chicken broth, tuna juice, water all over the house where that's
Mhm.
easily accessible. There's the hydrating supplements,
Mhm.
and I'm not gonna name the brand, but so there are different things that you, can do to increase hydration, and basically what that is doing is diluting the urine so that it's not irritating to the bladder.
Right.
So that is one of the main things, and then the other main thing is environmental enrichment, and so, the lecture that I went to that was talking about fluted,
Mhm.
what she said is perches. You need to have high
Yes.
perches, and that is key.
Mhm.
Cats like to look down on us because they are above us, right? They're superior to us in all ways. And so having those places that they can perch, where they can hide, where they have, access to good things.
Yeah. I
Yeah,
agree, and I would add to that intellectual stimulation as much as you can,
100%. Yeah,
like, anything to
absolutely.
keep those
Play.
brains
Yeah.
busy.
We talked
Play.
about our
Yeah.
5 pillars. Remember the 5 pillars
Yes.
that we had talked about with the safe place,
Mhm.
the, separate feeding, scratching, drinking areas, but then play was a part of that, making sure that
Yes.
they have that opportunity to express their predatory behavior.
Mhm.
That's super, super important. And so I would say those are the 2 main things, the diet, a wet diet, and environmental enrichment. Those are the main things that you can do to prevent recurrences of
Yeah.
urinary issues. Yeah.
Yeah. I wanna just
And
add
then
into
and
that
then
oh, go ahead.
while they are not feeling well, pain medications
Mm.
and anti-inflammatories. And so if there is an active flare, that can be really, really painful. And so just making sure that they do have something to cover the pain.
That is All good advice. So, when should a veterinarian loop in a behavior professional and vice versa on these types of cases?
I would say if you're having repeated episodes of urinary issues, or if you're just
Mhm.
having you've done all the things and your kitty cat still is not using the litter box, then I think that's a good time. Or, as I think about it, if you're just seeing that if you're in a multi-cat household, you're not able to manage the stress, then
Mhm.
sometimes having a behaviorist come in and just have a fresh set of eyes to look at things to give you a better sense of what you could be doing or should be doing to make everybody's cat life better.
Right. Yeah,
Yeah. Yeah.
makes sense.
Yeah.
Is FIC typically a long, like, lifelong management issue? Is this something that, like, once a cat gets it, it's something that they're gonna have forever?
Not necessarily. I mean, I've definitely seen the kitty cats that have an episode, and then
Mhm.
you make the right dietary and environmental changes, and they don't necessarily have flares continuously. So it's not necessarily some, and they're definitely the cats that you'll see have multiple episodes. And like I said,
Mhm.
maybe at that point talking to a behaviorist. But no, it's not something that is necessarily always going to be an issue.
Right. Okay,
Yeah.
that's good.
Yeah.
What does successful long-term management look like then to you? Is it just that you don't see these issues anymore?
Yeah, so there you don't see them having litter box issues. Yeah,
Right.
exactly.
Alright.
Yeah,
Makes
yeah,
sense to me.
yeah.
What what would be the most impactful change that a guardian could make today to reduce a reoccurrence?
Diet
Yeah,
and
diet
purchase
and water. Yeah,
and
yeah.
environmental enrichment and playing and, making life predictable for the kitty cat. Yeah, so
Mhm.
really those 2 things are the most important.
Yeah. And
Yeah.
I think what I was going to add earlier when we were talking about environmental enrichment and intellectual stimulation was that I have personally found with our cat who has this is that clicker training is really great.
Oh,
Because again,
yeah.
as we discussed, these guys can often be very, very smart, the
Mhm.
cats who end up having these issues. And clicker training is so great for them because it gives them
Yes.
like a
That
predictable means of
stimulation,
engagement with
oh my
you.
gosh,
They're
so
learning,
fun.
they have a
Yes.
love of
Yes.
learning.
Yes,
They know they're
absolutely.
getting a reward. Yeah, it
Mhm.
can be so great. So,
Yeah.
Kitten Man, when he sees that, like,
Mhm.
the clicker come out and we're gonna do
Mhm.
something, he's so excited that
Yeah.
he'll vocalize
Yeah.
because he's so
Yeah.
happy. So and that doesn't have to take a long time. It can take 2 to 3
Right.
minutes of your
Yep.
day because
Yep.
they don't have a long attention span, but it's really exciting for them.
Yeah. Yeah.
So, I
It's fun
really
for
can't
for
recommend that.
both,
Yeah,
it's fun for you,
exactly.
it's fun for your kitty, it's so fun. Yeah.
It
So
is.
definitely highly, highly recommend, yeah.
Yeah, I think that's really a great thing to do. I also, on just a completely other tangent, wanted to ask about if you have seen a lot of cats have these issues who are also like have a lot of urine retention. It's just because I've noticed that like with Kitten Man, that he even back to when I did my during COVID and I did my little
Mhm.
litter box study, that he and this was before Steve died, so this was before he was like a super stressed guy.
Uh-huh.
Everyone in the house would go to the bathroom, would, like, urinate 4 to 5 times a day,
Uh-huh.
minimum. He would only go twice, which is still
Oh,
the pattern. He
interesting.
goes
Uh-huh.
once in the morning and once at night, and so
Uh-huh.
he's always retaining urine, and it's always been very, very concentrated,
Oh, interesting.
and
And that's despite trying to get more fluid into him, like getting him to drink
yeah,
more?
he
Uh-huh.
drinks because when he pees so much. The volume
Uh-huh.
is crazy, so he is
Uh-huh.
walking around half the day needing to pee,
He,
but
uh-huh. It
he
won't.
only wants to go. Yeah, and it's
Yeah.
not he's not being there's not any
Sure.
litter box
Yeah.
issues, and
Yeah.
there
He's
certainly
just
weren't
lazy.
or it's
You
just
know,
something in his head.
I I don't think that there actually is I
Okay,
mean, as far as I know, but I do feel like there is individual variation in both dogs and cats. Like, I'll have some people
right.
tell me and actually one of my dogs, would pee once a day, and it would drive everybody crazy.
Yeah,
If I had a house, sitter come to stay if I was traveling or whatever, and
yeah,
they would, always text in a panic, "Roger hasn't peed." "Oh, yeah, I forgot to tell you he pees once a day." That's how he is.
yeah,
But and so I think there is individual variation. I do think though that if a urine is really concentrated, it can be more irritating. And so I feel like
yeah,
if anything, they're going to probably try to pee more, but maybe that's not the case. I don't know if he's just like, I don't want to pee. I'm not going to do
yeah.
it. I'm
I
I'm
don't
too lazy. I'm not gonna go to the I have no idea.
It's very strange because this has been his behavior since he was a kid, so
Uh-huh.
it's just how he is.
Yeah.
But it's just it has been in the back of my mind, like, could this be not the only driver, but a partial driver if he's holding his urine all day
Mhm.
and it's becoming irritating his bladder, and then is
Yeah,
that
for
leading
sure.
to
Yeah, yeah, yeah.
I don't know,
I think that's a
this guy.
possibility. Yeah.
Yeah, not that he's had any issues in a long time, thank God, but it
Uh-huh.
just
Yeah.
like, why just go to the bathroom. Like, we have
Right,
bathrooms
right, just
everywhere. Just like,
pee.
please
I
just go to the
know. I
bathroom.
know.
Like,
Yes, yes, yeah.
why are you doing this? Anyway, okay. Um, is there a piece of outdated advice about feline urinary health that you would love to people to just like retire?
I think the biggest thing is the just do antibiotics would be
Yeah.
the worst medical advice. I would want to get rid of that. But then I think the most outdated perception would be
Mm-hmm.
that your cat is doing it to spite you.
Yeah.
So those two things, yeah. Would
Sure.
love to get rid of that.
Yeah. Yeah. So is there one thing that you want cat guardians to kind of like take away from this or remember about urinary issues and behavior?
That they can be emergencies. Don't
Mm-hmm.
ignore when your cat is straining to pee. Make sure that you see your veterinarian sooner rather than later. That it is important to identify those kitties that are so sensitive. So,
Mm-hmm.
because they're going to be at higher risk, and just make sure that you're paying attention to that. Make sure that you're really giving them stimulation, environmental enrichment, play. Oh, and so actually, have you heard of the Ohio Indoor Cat Initiative? Ohio State Indoor Cat
No.
Initiative? So it's
Mm-mm.
Ohio State University Vet School. It has a website. It's the Ohio State
Hmm.
Indoor Cat Initiative, and it is a
Okay.
whole website of information on how to give your cat a great environment, like what you should be
Oh,
doing. So,
all
yeah,
right.
that's very, very helpful.
Okay. I will look that up and I will put it in the show notes
Yay!
for this episode. And do you have any resources as to where listeners can find more reliable information about
Yeah.
FLUTD and FIC? And I
Have
can
you
also
heard
link
of
those.
Yeah, icatcare.org. Have you heard of that? The
Yes, I
International
totally
Cat
thought
Care.
you were gonna say, "Have you heard of Google?" And I was gonna be like, "Oh, Gina, oh." I totally thought
Just Google it. Good Lord. Have you heard of Chat GPT?
just, like, totally
No,
be
no,
so
no,
mean
no.
to me.
No, 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 no.
Okay.
And it's a I'm talking
No,
about
I haven't.
yeah,
I don't
yeah.
think
No,
I
it's
have.
fabulous. It's got
Okay.
information on a variety of different things,
Okay.
asthma, urinary issues.
Hmm,
Yeah. So that's
alright.
a great resource for clients.
Cool. Thank you. I will link that also in the show
Excellent.
notes.
Google, ChatGPT.
I know you and I love AI so much.
So much, so much.
So, so much. Alright. Well, thank you so much, Gina. As always, you're the best vet in the
Aw,
whole world, and we
aw,
love you so much, and thank you for putting up with me and coming on the show again to talk about this very important issue, actually, that
very important issue.
that
Yes.
is very important for, cat owners and male cat owners especially, and that I do really see a lot of in my practice, which is why I wanted to talk about it. So thank you.
Thank you. Thank you for having me.
Thanks so much for listening to the show. If you're looking for one-on-one support with behavior issues like litter box problems, aggression, anxiety, or multi-cat dynamics, you can find me through my behavior consulting business, Catitude Adjustment, at catitude-adjustment.com. If you like the episode, please consider leaving a rating or review. It really helps us grow. For more episodes, show notes, and resources, head to hissandtellpodcast.com. Huge thanks to Cat Beats for the music, and I'll see you next time.